Hi guys, it's Tina. Newborn assessment video. Try to get it right the first time. Okay, I'm going to start with general observation of the baby. We're going to look at and make sure the baby's pink. The posture is flexed. The head should be about a fourth of the size of the length of the baby. Movement as the baby moves should be bilateral. I'm going to observe the skin for melia, stork bites, and arrhythmia. Start with the head. Going to feel as far as the fontanelles, we're going to make sure that the anterior is diamond shaped. Going to lift the head slightly and feel the back to make sure that it is triangular. If the fontanelles are flat or sunken in, that could be an indication of dehydration. If they're bulging, it could be an indication of increased intracranial pressure. I also want to look and make sure the sutures, the fissure lines of the baby's head. If you have the caput succedaneum, that could be swelling at the crown here due to the pressure from coming through the birth canal. And normally, if the mother is concerned about that, you could tell her that it normally goes away from 1 to 3 days. A cephalohematoma could be bleeding between the periosteum, but the thing with the that one is it does not cross suture lines. Excuse me. Next, we could look at the baby's eyes. You also want to note the color and make sure that they are equal and reactive to light. You also want to check the baby's patency as far as the nostrils. So you would take and hold the nostril of one and let go, and then hold the other and let go. You also want to note the baby's ears and make sure that they are in line with the outer part of the eye on both sides. You also want to note the baby's mouth to see if there is any circumoral cyanosis. And then you can take and feel inside the baby's mouth to make sure the cleft palate or if there is any Epstein pearls. With these circumoral cyanosis, if it decreases with crying, it should normally decrease with crying. If it does not, then that could indicate some cardiovascular issues. I want to look also at the baby's neck to make sure that there is no webbing or a fat pocket is in there. If that is abnormal. While we're here, want to do the baby's hands to see if it cups my finger, which is the palmar reflex. I also want to check to see if there is creases within the baby's hand. The simian crease would indicate genetic problems. So we want to make sure on both of those that there is more than just one crease line. Let's see. I want to also start with respirations. You should always listen to respirations for 1 minute. The normal is 30 to 60 breaths per minute. You count the breaths per minute because most of the time babies' breaths are irregular. They also have short periods of apnea. And we also want to note if there's any signs of distress, which are retractions, circumoral cyanosis, flaring of the nostrils, grunting, um, asymmetrical chest expansion. So we want to make sure, and they're also belly breathers. So we want to make sure that we put our hand to make sure that that's happening properly. Also note that babies coming through the birth canal, it assists in getting the fluid out of their lungs. So if your baby is born by C-section, then you're probably going to hear more fluid within the lungs for the first little bit after birth. As far as listening to their heart, you also want to do that for 1 minute also. Normal is 120 to 160 beats per minute. And you want to use a pediatric stethoscope. I have mine, but is a regular. You want to listen with a pediatric stethoscope to eliminate extra sounds such as vowel sounds. Normal BP for a baby is 65 to 95 over 30 to 60. So we want to note that also. Let's see. Oh, I did forget. When measuring the head, you also want to measure above the brow line, and it's measured in centimeters, and it's normally 32 to 38 centimeters. Now that since we're at the chest, you would also measure the chest circumference at the nipple line. And you also want to make sure that the nipples are even and not swollen. If they are swollen, that could be due to some maternal hormones that the baby still has. Chest circumference could be 30 to 32 centimeters. And once you get down to the abdomen and listening to the bowel sounds, you want to listen before you palpate. But once you palpate, the stomach should be soft and round, and it also should be symmetrical. Should not be bulging on one side or at the umbilicus. And if it is bulging at the umbilicus, it could indicate a hernia, an umbilical hernia. Going to do the Moro reflex. You lift the baby slightly and then let it back down. Is the Starl reflex. So the baby's arm should abduct and the fingers fan out and then come up and form a C position near the baby. It's hard to see if it does react. Like I said, we did the Palmer reflex and the simian crease. This is very important. Then we're going to move on and do the test for the ortolani click. So you're going to see if my baby will stay here. Up and then rotate out. And as long as you doesn't hear a click, that you do not want to hear a click, that would indicate some hip dysplasia and some issues going on there. You want to check the toes. Make sure the baby has 5 toes on each. And then you want to take and check the baby's reflexes. Run your finger from the top of the foot down. And as they do that, then the baby's toes should hyperextend to that. And you also want to touch it, and the baby's toes should curl. And that's the plantar grasp. And do it on both. Then we're going to turn the baby over. And we're going to check to make sure that the back is straight. There is no dimple here at the sacral area, which could indicate a not saying that correctly, pilonidal cyst or a sinus. Also, if there is an indentation or a tuft of hair, that could indicate spinal bifida. And you also want to look for Mongolia spots. It's most common in African Americans or Hispanics. So you want to make sure that none of that is visible. And then you want to check the baby's buttocks to make sure that that is symmetrical. The legs are the same length. Then turn the baby back over. And last but not least, you want to check the baby's genitals. The labia on the female will be edematous. There also could be some vernix that is still there from birth. And she also may have discharge or bleeding, but that could be also from maternal hormones that's there. As far as the male, you want to make sure that the scrotal is same on the testes are down and the same on both sides. You also want to observe the penis to see if there is epididymis or hypo, to note that in case if the baby does have that, then that can be taken care of. The anus should be observed for any fissures. And that concludes my assessment.